Yes, go ahead, please.
Okay. Good morning, good afternoon, good evening, everyone. My name is Jero Catletto. I'm a manager in the Development Data Group at the World Bank and currently co-chair of the Inter-Secretariat Working Group on Household Survey. Thank you all for joining and welcome to everyone. This session has been organized by the Inter-Secretariat Working Group on Household Surveys, which was created in 2015 under the aegis of the UN Statistical Commission. So the Inter-Secretariat currently consists of 11 international agencies and eight countries. And the objectives of the Inter-Secretariat working group is to improve the coordination around household surveys, support innovation and the development of new methodologies, as well as to advocate on the importance of household surveys. So Howie will share the link in the chat. So I will encourage you to visit the website where you will find a lot of information about all the different task forces currently active under the Secretariat. Today we're all here. You all know why you're here, so I hope. As we're painfully aware, the pandemic has caused a major disruption around the world on every aspect of our lives, but also, and in particular, I would say also on our work on household surveys. On countries' work on household surveys, based on a survey of NSOs that we conducted together with UNSC and in partnership with the Regional Commission. As of May 2020, so only a couple of months after the outbreak of the pandemic, almost 100%, exactly 96% of NSOs as either partially or totally discontinue, halted household surveys. So as we see now, after almost 2 years, things are reopening slowly. In some regions more than in others, faster than in others, but there's still kind of we're still not back to where we were 2 years ago. But what we have seen in these 2 years, in response to these challenges, the challenges posed by the pandemic, but also to meet at least the most immediate data demand, NSOs have responded and quite vigorously by adopting new technology, new methods, using new data sources and new modes of data collection. For instance, by using high-frequency phone surveys or by using web surveys or social media data and remote sensing data and other sources. So the good thing is that we have seen is like how the pandemic has accelerated a process of transformation of statistical systems, which was already ongoing, but because of the pandemic, there was a major thrust, a major shift towards new innovation, towards the adoption of new methods. So today you will hear. I mean, this session is about sharing for several countries in the panel to share some of the experiences in how they have adopted, how they have engaged, like you just said, and adopted, innovate by, for instance, we'll hear about the adoption of phone surveys, like you just said, which is something that traditionally has not been in the toolkit of national statistical offices. but also use of other methods. So my role as co-chair pretty much ends here. I will hand it over to the able hands of Kieran Walsh, which is Kieran. You probably all know him. He's a senior statistician at ILO. So he will be coordinating a panel, and including, again, several countries. And I guess I'm assuming Papa and me will jump in at some point. And then following the panel, I mean, probably there will be questions from the chat, which Kieran will coordinate, and then we'll end with Papa Sek, my partner in crime, is as a co-chair of the Inter-Secretariat Working Group. We will give some closing remarks, some kind of his views on the session, and a little bit of a wrap up. So without further ado, Kieran, the floor is yours.
Okay, thank you, Gero. Thank you very much, and welcome to everyone to our cyber side event, as we should start calling them, I think, of the UNSC under the auspices of the Inter-Secretariat Working Group and Household Surveys. Looking forward to a very good discussion today on what has happened and what we have learned from it in the last 2 years in the area of household surveys. We have 4 excellent panelists joining us today for this discussion. I'll briefly introduce them. Firstly, we have James Muonge. He is the head of surveys in the Uganda Bureau of Statistics. James is very well known to many of us. In fact, from the ILO side, we've been working closely together in the last year on various surveys and studies. And he's been leading surveys like the Labour Force Survey in 2021 and many others. So he has excellent experience to bring to this discussion. Secondly, we have Sophia Ibrahim from the Central Bureau of Statistics of Palestine. She's a director in the organization. Over 10 years at the CBS, she's been working in various areas, including environmental statistics, and more recently, the Statistical Monitoring Department. And in that time, she has worked on various surveys. So again, bringing a wealth of experience to this discussion. Thirdly, we have Ali Saeed. He is the Director of Population and Labour Statistics in BPS of Indonesia, or Statistics Indonesia, as they can also be known. His current main areas of focus are population and labour force statistics, but previously he's also been a Director of Analysis and Development of Statistics. And lastly, but by no means least, we have Larry Mcnabb. He is an Acting Director General in Statistics Canada in the Social Data Insights Integration and Innovation branch. He has a very long career of over 25 years in statistics and working across many fields of statistics in Statistics Canada, and including in recent times the modernization of social statistics and household surveys. So we have an excellent panel, it's fair to say. And as Gero indicated at points, we can also get some insights from Gero and Papa in their roles as heading up international statistical programs as well. So I'm going to start with an initial round of interventions from all our panelists. And as Gero said, our area of interest is what's happened with household surveys, the challenges that have been faced, and the solutions and adaptations countries have made in the last 2 years. And in our terms of, in the briefing note we had for this session, you might have seen online, we had 3 general areas. There was the idea of accuracy and timeliness. So in some sense, we could call this the balance between increased demand for statistics and your ability to provide them, perhaps. We also had the issue of inclusivity, which is our ability to reach everyone that we need to reach. And we had the issue of ethics. So do we have any ethical issues arising? So what I'd like to do starting off is turn to each of the panelists and maybe give a first intervention of 4 minutes, just telling us what is it that you actually faced. Tell us a little bit about the demand you faced, how you dealt with that, what kind of challenges you face. And in this first round, if we could stick to approximately 4 minutes. Perhaps, if it's okay, can I start with you, Ali? Your experience in Indonesia. Thank you.
Thank you, Kieran. I hope I have no problem with the connection. I just got trouble. Good morning, ladies and gentlemen. Good afternoon and good evening in Jakarta. Thank you. I would like to respond what have been done in Indonesia. Since the outbreak of COVID-19 pandemic, the Indonesian government needs information to know about what the impact of pandemic on the community, on a number of aspects, as well as quicker data for making decisions. On the employment sector, for example, the government wants to know the information regarding the impact of COVID pandemic on unemployment, working hours, layoff, etc. And the government also needs information on the COVID impact on other aspects of socio-economic that we collected from the National Socio-Economic Survey. To respond to this demand, BPS Statistik Indonesia has taken several initiatives, including first adding new questions related to COVID impact in two main important household surveys, namely National Statistical Survey and Labor Force Survey, and suspending several surveys that are not classified as priority surveys, and then utilizing alternative data source such as big data, and the last, conducting new surveys on online basis to respond to the demand for a quick data that usually should be available within 2 to 3 weeks. And this online survey were based on the non-probability sampling actually, which is directed towards supporting a quick information for a quick decision. Thank you.
Okay, thank you, Ali. Already some things I know I'm going to have to come back to, like these online surveys and how well you feel that they worked, but we'll come back to that. Maybe next, could I turn to Sophia? Can you tell me about the experience in Palestine over the last 2 years of trying to meet demands? Just how serious were the demands? What did you do? And yeah, I mean, what have you learned as well, perhaps? Sophia, if you can come in.
Sophia, you're a co-host, but I don't see your mic button there.
Okay, maybe while we try to work out
Yes.
that, could I maybe turn along the same lines to Larry? Can you tell us about what's happened in Canada, some of the challenges, demands, etc., that you face and how you've dealt with them?
Certainly, and thanks everybody, and good morning, good afternoon, good evening. So as I go back over, it's been a pretty crazy 2 years, which I'm sure has been the same for everybody. It's almost 2 years to the day. We found out we were locked out of work and thrust into the working from home environment, which as you can see is where I'm at here, or it's a really cool office. You know, so we've approached this from a number of ways. I think when this initially started, there were several major concerns. First is, how do we keep our mission critical surveys, such as our labor force survey, up and running? You know, I think the key part there that was impacted was our ability to do personal in-person interviews, which is a key component in getting at those really hard to reach populations. So our operational folks have been and still are experimenting with different means of doing that. And then there is really the, how do we meet the demands of not only our policy folks but our public health folks. and our folks involved in the economy and getting at those short-term issues requiring timely data, and also when we're talking about some of our public health modelers, those issues requiring very precise estimates to do proper modeling. So very early in the pandemic, we started with a crowdsourcing methodology, which was, we had dabbled with crowdsourcing before as an agency and looking at things like trying to estimate the price of cannabis, which is now legal in our country. But we went full on and launched within, I think, so we were locked out the middle of March. By the beginning of April, we had set up a crowdsource web panel survey on our website and through the media, asked for participants across the country in our networks, and we had 250,000 Canadians respond to our very first crowdsource on this. I think we had set some very modest targets, and maybe we were hopeful to get between 5,000 and 10,000 folks respond. But the pandemic was new, and the media gave us a bit of a helping hand, and we got some overwhelming response there. And there's an important part there that allowed us to not only get some basic information on how people were behaving. It wasn't representative by any means, but with the sample so large, we were able to make some intelligent guesses. Were people following, tending to follow public health guidelines and that type of thing. But more importantly, it bought us time to implement some more rigorous methods. So we had coincidentally just prior to being locked down, completed recruitment for a probabilistic web panel, which allowed us to very quickly through email get participants and send them content and get input. And that also then further allowed us to dig into our more traditional methods of household surveys and use our frames and approaches to stand up even more thorough methodologies. So we've been working that since the last couple of years, and we've been refining it. So I think I think it was Jiro who mentioned, it really forced us to accelerate the modernization plans we already had underway, and even push us out of our comfort zone and develop and innovate new items we hadn't even thought about. Even with the crowdsource, I think we did 7 or 8 of them during that first year of the pandemic. And we reached out to almost 500,000 Canadians just through crowdsource surveys in response to those. So I'll stop there. I could go on for a whole morning or day, but I think that gives a good flavor of how we approached data collection as part of the pandemic.
Thank you for that first overview, Larry. And I'm sure everyone listening to this is going to be interested to hear a lot more about crowdsourcing as an approach, which appears to have been successful, which is great, obviously. So maybe at this stage, could I turn to, Sophia, will we see if you're able to connect?
Sophia just rejoined. Hi, Sophia. Yes, she's on.
Great. So yeah, feel free. So just a first overview of up to 4 minutes of the demands that you faced in Palestine in the last 2 years, and how you went about facing those demands and dealing with them.
Yeah, sorry for the technical issue. Firstly, good morning for all. I want to say that the year 2020 was an exceptional year by all measures, as the COVID-19 crisis was fast changing and its impact for reaching. In addition, the COVID-19 pandemic overshadowed everything surrounding us. PCBS and its program were affected by this pandemic, similar to other various institutions and sectors. They pushed PCBS to develop new working tools and the methodologies to accommodate the requirements of this space, as well as the restriction and the measures it imposes. This was necessary in order to guarantee adhering to publishing statistical data on time, as specified in the calendar of statistics, to provide decision makers with the statistical data that reflect the impact of the crisis on various sectors, and to contribute to the development of policies, programs, and interventions necessary to facing this unexpected and sudden pandemic. So many procedures were undertaken to handle the crisis and the state of emergency on the administrative and institutional level, on the technical level, on many levels at BCBS.
Okay, thank you. Yeah, I mean, in further rounds, we'll come back to in a bit more detail on some of the actions that were taken. But to finish off among the panelists, before I go to our co-chairs, James, could you say a bit about the situation in Uganda, again, demands faced, how you reacted, and so on?
Good morning, good afternoon, good evening. Uganda, just as has been mentioned, I think the situation was probably not different. The demand for data actually was increased because everyone seems, and every institution seems to have been concerned about what's happening to their area, especially the issues of gender, issues to do with employment, issues to do with the vulnerable populations, how to target them and address their concerns. So there are quite a number of demands along those lines. And the challenge was that, of course, the face-to-face interviews couldn't take place. And the other traditional ways of collecting data couldn't go on. We actually had an ongoing household survey, which we had to stop. We halted halfway. So, and we resumed after they lifted the lockdown. There are also challenges to do with, okay, if we are to have this sample, which frame do we use, given that not all of our population have access to telephones. And so, of course, we had to
I think we might have had a connection difficulty with James there. Give him a second to see if he can come back. Okay. Yeah, perhaps, I'm sure, hopefully he'll be able to reconnect. But now I might just come to Jero and Papa. Maybe you first, Papa. So we've heard from all the panelists from all the countries that there was a serious increase in demand, which challenged their normal ways of doing household surveys and collecting data. And there have been various innovations. But what about at the international level? It's somewhat different. I mean, there is obviously demand, but of course we're trying to operate across countries, so it creates a different context. So can you tell us a little bit about what UN Women has been doing in the last couple of years? What are the key messages from your work program? Papa, I'm hoping you're still connected.
Yes, thanks very much,
Yes,
Kieran.
go ahead.
Thanks
Go
very
ahead.
much, Kieran. So yeah, no, absolutely. I think just I think as Larry has said, we early on, I think in March, sometime last, we went to the office one day. The next day, we were told to stay home. Right. So and across our organization, really, I think alarm really grew quickly because we had an idea what was at stake. For instance, when women are locked in violent relationships, we know that bad things happen. And in this case, they were locked with perpetrators and on a massive scale. Women's unpaid work, care work also increases when more people are at home, and that leaves them to leave the labor force. So in that way, I think COVID-19 was a perfect storm. And within UN Women, everybody basically turned to us for demands for data. And this was really, I think, any data to tell us what was happening. So the response was really to start innovating, essentially knowing that our usual partners at the national level were also turning to us for solutions, right? So what can we do to collect data that is actually good enough to tell us a story about a panoramic picture, rather than basic, I think, more precise statistics that would, at that point it was impossible to collect. So working with our national partners, we've supported more than 70 countries to conduct rapid assessments, the gender assessment surveys, and but this didn't happen overnight. We knew that, for instance, everything couldn't be done at the same time. So in fact, we had to do things in a phased way. And for instance, we started in April 2020 with RGAs in Asia and Pacific, and then, with that experience, learning and following suit in other regions. And one of the other things is that basically the pandemic didn't happen everywhere at the same time, right? So, there were different regions started bearing the brunt of it at a different time. So that allowed us to really adjust and learn as we go. And on just, I think one final point for me is really on the quality aspect. There are, of course, areas where you can't compromise on quality, and particularly on ethics. And that example is on violence against women. Because once you do, then you can put the victims and, the people that you are trying to interview, you can put their lives in danger. So, for instance, the last violence against women surveys, rapid gender assessment surveys that we did in 13 countries was done with, first and foremost, that question of quality and ethics coming first. So basically, in this case, we were able to collect good enough data that, of course, doesn't rise to the level of regular violence against women surveys, but also that was able to give us a good picture of what was happening around violence. Thanks, Kieran.
Thanks, Papa. And I know very carefully, 3 words that you used: good enough data. And I think that those are actually 3 very important words we might reflect a bit more on. And yeah, we'll come back in further rounds. But maybe before that, I might turn to you, Jero, and say a bit about the World Bank experience. Maybe in your case, similar context, different topic than UN Women to a point. But I mean, was it a similar experience? How did the bank react in the last couple of years? And what did you learn from that?
Yeah, thanks, Kieran. Obviously, it's a similar experience, but on different issues, because clearly, all of a sudden, the bank found itself with a need to guide major operations, also in response to the pandemic, without the proper data. So if you think about it, probably was about in this short span of a few months, the bank increased dramatically the support to social protection programs, but in response to the pandemic, to address some of the crisis situations that the pandemic is. But again, the data were not there. So in response to the same with vaccine rollout or in response to the education crisis. So I think there is the bank, as you know, works across the board on whether it's health, education, social protection, and the need for data just mushroomed overnight. But at the same time, the instruments that we had at our disposal were much reduced. So in response to that, so basically we did all of the above, anything that has been mentioned, like just whether it's to turn to phone surveys, and in the case of phone surveys, whether it's using digital random dialing or whatever frame we could find. So use more intensive use of administrative data for uses that we have not explored in the past. A heavy use of remote sensing data use of citizen science data. So in a way, so we try in every country, and it depends on the country, depends on the availability of data, depends on the capacity of the country. We try to respond as much as well as we could. And as I was saying at the beginning, kind of accelerate this process of modernization and transformation. And the good thing was, as I was saying before, countries were a lot more responsive now. NSOs were a lot more responsive to change, were more responsive to risk, so more open to risk, which is kind of, again, it created this virtuous cycle. So not everything was bad in that respect. But I just want to concentrate on three concerns, like just which is kind of come from the lesson learned in these 3 years, but also in a lot of ways also come from the messages from the surveys of NSOs that I was referring to before. So these are kind of the voices of the countries that kind of what we heard today from 4 panelists. But through the survey of NSOs, we're trying to hear from more than 100 NSOs what their concerns were. And I think there are, like, to me, three things to keep in mind as we move forward. One is don't go back. So because it's a risk to go back to the way we used to do things that we were comfortable with. And that's always a risk. As things like now relax, there is a tendency to go back to what we know best. And I think that's a risk that we need to avoid. Two is what Papa was mentioning: quality, accuracy. So you mentioned at the beginning the issue of accuracy, and again, so this a push towards new methods, whether it's crowdsourcing, whether it's web surveys, social media data, phone surveys. So those are like solve a lot of problems, but creates also a lot of problems because when we think about representativeness of just to name one, like a representative of a lot of those data. So as a household survey community, what we want to really think about how we use a household survey, how we use the strength of household surveys, like the representativeness of household surveys, to as a tool, as an instrument to adjust adjust for potential biases of these other data sources. In a way, again, I'm trying to see the positive side of it, like, because we can add to the value of household surveys in this context in which, like, I mean, of course, we're looking in other direction. We're looking at different data sources, but there is a role for household surveys in improving those data sources. That's that. The third and final point I want to make, which was mentioned, is the issue of equity. But beyond the equity towards vulnerable groups and leaving no one behind, I think there's also an issue of a cross-country equity. So another thing that emerged very clearly from the surveys of NSOs that I was referring to before, which Alberto, I think, just put a link for everybody to so if anybody's interested in visiting the page, it's the issue of differences in this processes of modernization, of adoption of new standards, of new methods, and new approaches across countries. So with some countries lagging behind, and this is the role of international agencies, like an international organization like the bank, just to ensure that through proper support to capacity development in the adoption of in the uptake of these new methods, but also in terms of financing. So financing this acceleration and the transformation, the modernization of statistical offices, particularly the neediest one. I think that's something that it's important to keep in mind. And this is why For instance, we've been working very closely also with Paris 21, with UNSC and other partners in setting up the right financing mechanism and coordination mechanism like the clearinghouse and the global data facility in order to support this transformation and creating a level playing field for all countries. Back to you, Kieran.
Thank you very much for that, Joe. I mean, some very good points there. I mean, moving to our second round here, I'd like to focus in a little bit more on this balance between accuracy and timeliness, which somehow I think underlies everything. We've had a big increase in demand. Users don't always understand the quality aspect we're trying to impose. They want quick data, right? And maybe aren't always too concerned about how it's gathered or how quickly. So I'd like to just dig in a bit more on some of the balances that we've had to face. So for example, there's always, and this isn't new to the pandemic, there's always been a tension between the need for quick data and the need for high quality. I mean, timeliness is also a dimension of quality, but the other aspects of quality, like accuracy. So for some of the countries, I'm just wondering, do we think the balance has permanently shifted between these things now? Has timeliness suddenly become a much heavier aspect, and maybe there's a little bit less focus on data quality, or can we somehow balance these things out? Maybe I'll come to you first on this, Larry. You mentioned this need to protect the existing core surveys like the Labour Force Survey and others, while at the same time trying to balance this demand for quick data, even going to non-probabilistic surveys where needed and so on. Has the balance shifted, or do you think you can truly maintain that into the long term?
I don't think we have a choice but to maintain it. We've, I think, elevated the expectations of our user community here in Canada. And some of the things we learned, like crowdsourcing in the early days, it was really it was in very high demand, to the point that we developed a directive internally on when and where it was most appropriately used. And there is a lot of outreach work with even our user community on how to use it, and we even internally some new terminology, so we don't weight a crowdsource, we benchmark it. I kind of sell it. It's in between. It's a kind of a quasi-quantitative approach, so it's not full-on probabilistic methods, but it's much more thorough than, say, a purely qualitative study. So it's a really big focus group. But what I think what it's done is it's allowed us to have better conversations with our users on talking about really, what do you want to do and what is good enough. And that good enough conversation is very important because it feeds into, timeliness, costs, because as we all know, accuracy comes with a cost, not only in terms of dollars and cents, but in terms of timeliness and increased sample sizes. And so all of these new methods, we're really starting to find a place for them within the agency. We're still growing and experimenting and developing them, but I think it's safe to say we've added these new methods to our tool set. And as we kind of develop our experience with them and our users as well become more comfortable with the various approaches, I think there's a place for all of them. So, and it runs the gambit from, we're actually just launching a new crowdsource today on people's ability to access rapid COVID tests here in Canada. Because there's a need currently right now for that information. We don't need to know precisely, but we do need to know more or less, are people getting what they need from in terms of access to test. To, we just completed our census and we released our first results a couple of weeks ago. And now we've got the full stream of very detailed and specific post-census surveys where accuracy is key. And because we've set them up through the census, we're allowed to measure that. And then we've got the in-between, some interesting things we're working on now You know, our agency received a significant amount of funding from our government to deal with the notion of disaggregated data. So being able to spit our data out between, you know, racialized communities or indigenous communities, the women, folks with disabilities. And we're even exploring how we can further take the notion of our probabilistic web panels to target specific groups to allow that kind of quick turnaround, but also be more efficient. Because as we all know, if you can't target groups and you're trying to get that small groups with a very large sample survey, that starts to cost a lot of money very quickly. So I really think we're evolving as an agency, and we're still growing in how we use all these tools. But, you know, to get to your question, there is no going back. And if anything, we've raised expectations, and we've got to figure out how to do more with what we have.
Yeah. No, thanks, Sorry. Maybe Sophia, if I come to you, but along similar lines, I mean, how different is the conversation with policymakers, users, funders now in Palestine about the need for household surveys? Are their expectations different than what they used to be? Is it harder for you to get messages across about what you need to do to assure quality? So how has that changed for you?
As I mentioned before, yeah, can you hear me?
Yes, go ahead.
Okay, thanks. As I mentioned before, at the beginning of this sudden pandemic, the field work of all statistical activities was stopped. At the same time, the demands of new types of data, specifically those are related to health, economy, education, tourism, employment, was rising. So the timeliness of data is an important data quality characteristic because information that isn't timely can lead to human making the wrong decisions. In turn, that organization costs time, money, and reputational damage. And we can't deny that publishing detailed data during the corona pandemic of infected person, economic situations, and education from other parties drew attention to these agencies. As so, data is more close for practical life. And this imposes statistical agencies to reconsider the traditional methods of collecting and disseminating data and moving from traditional procedures to modernization, as well as SDGs to be considered. I think the stage of any crisis must be characterized by flexibility in somehow, and in the context of ensuring the use of data for quick decisions, we have to ensure the protection of individuals other than the time of well-being, with attempts to diverse in methods for data collection with the guarantee of the required standard. However, we have to keep in our minds that better lives matter and people's life are always is the most important thing. So the balance between the accuracy and time is so important as the dimension of the quality for data collection.
Yeah, thank you, Sophia. Maybe James, coming to you on this point in Uganda. I mean, if you compare now how policymakers are speaking to you about their demands, is it different? I mean, are they just interested in I need quick data, or can you still have a more detailed conversation with them about the need to support household surveys and so on?
Thank you. I think as has been mentioned, there are those who really want quick data, but when one looks at the development frameworks, the National Development Plan, the result framework is clear. It kind of like the kind of indicators that are needed to monitor the interventions is really, they are more of the traditional, from the traditional household surveys. And so what also we have realized during these 2 years of the pandemic, that there are certain there is information that you can easily pick from the quick surveys, but there is also information which you can't easily get from these quick surveys, which has to also come from the more detailed surveys. And so as one looks at how to balance these two, I think it's important that much as timeliness is important, but then also we need to look at what kind of indicators are providing so quickly. Because as has been mentioned, when there is like a census or a large exercise, the temptation to compare will definitely emerge. And once there is a variation, then the question would be, why is this variation occurring? Now, you don't tell them that I was giving you something quickly. They always want to have something that is comparable. And so these, to me, what seems to come out is that, well, with the quick surveys, I think also we need to make sure that the questions are right, but also to be mindful of those indicators that are likely to change given the mode of data collection, so that we minimize on the questions that will be asked later on as to why there are differences. And yet these are differences that came because we wanted to fill a gap, a data gap. But unfortunately, when it comes to presenting results which are contrary to people's expectations, they do not think about those, the need to fill a gap. They will just take you on the methodological front. And so I think the balancing, in my view, is something we have to think about carefully as you go forward. Thank you.
No, thank you, James. I mean, I certainly think you're right. We also need to learn about this, actually, also on the international front, because the need for quick data is there. It's very high priority. And if we look at areas like the labour force, we still want to maintain high quality of employment and unemployment statistics. But except that in rapid surveys, these are important things to cover because they can explain a lot of people's experiences in certain ways. So it's important to cover them, while at the same time understanding that you can get different indicators if you use different sources. So this is always a bit tricky. Sophia, I see you want to come back in maybe on this point. Please go ahead.
Yeah, just to add here that the decision maker, their attention were more focusing on more specialized surveys or household surveys to measure the impact of the crisis, to measure the socio-economic situation. So the National Statistical Offices or BCBS is more focusing on this kind of more specialized household surveys to know the impact of the COVID-19 on the household at all levels. Yes, that's what I want to add.
Yeah. Ali, maybe I could come to you on something. You talked about the non-probabilistic web panel surveys that you started doing in Indonesia in the last couple of years. I just had this general question. I mean, that anyone could answer, but I might come to you. Are there things that you did that you definitely would continue to do after things settle down, whenever that is? Or are there things that you definitely don't want to continue to do? And I have in mind Jero's message here about don't go back. Do you feel that pressure, or internally or externally, to go back and say we'll do things the way we were, or do you think you can maintain this progress?
Yeah, thank you. Yeah, in the case of Indonesia, when the government asked TPS to provide quick data for quick policy, the only one that we can support is by conducting online survey on the basis of non-probabilistic sampling. And in this case, the issue of accuracy and timeliness may emerge. And actually, in PBS, we have conducted about, I think, 4 times online survey on the basis of population and for business impact of COVID, 4 times also during the COVID. And during this online survey that we conducted, many appreciation from the stakeholders of the user, especially give a big appreciation to BPS, because we can provide a quick information with that what they need, even though that is based on non-probabilistic sampling, because what they need is the timeliness of the quick data that they want. But in terms of the accuracy, how to deal with, in minimize the bias that occur from the non-probabilistic sampling, we try to conduct the survey in timely manner, and also try to give, if we said we cannot say it's accurate, but we try to minimize bias by like make a bigger coverage in terms of regional coverage, and also representativeness of the respondent, whether from educational background, urban, rural, and also marital status, for example. Then we try to control this because we have regional office until district level, and we utilize all resource there, and by using the network that we have in all our government employee in PBS, and they share the link of the survey, so we can reach all people in the whole region of Indonesia. And then when we combine the sample from this online survey with the sample size, sample distribution of the national socio-economic survey based on the probabilistic sampling, the pattern is nearly matched. So that's what we can control from this distribution aspect of the sample survey in order to minimize the bias of the online survey that we conducted in Indonesia. And we try to continue this online basis in the future, but maybe with some improvement, because we can collect a large number of people who send their phone number to the survey that we ask to them, and they give the phone number to us. Then we can manage this in the future for other survey, any survey based on online basis.
Okay.
Thank you.
Thank you, Ali. And I think you've brought us nicely into the next general area of inclusivity. And I mean, inclusivity can mean many things, but in one sense, a particular challenge many countries have faced is reaching a representative group of respondents in the last 2 years, and countries have adapted in many ways, including turning to telephone surveys or online panels as well, as we've heard. And I'm just wondering about this challenge of trying to cover as much of the population as possible. We, just for information, the ILO, we did a survey of countries on the impacts on their labour force survey. And we found that nearly all countries had serious impacts on their ability to collect data and had reacted in various ways. In fact, over half of the countries who didn't already have telephone interviewing started to make use of it during 2020 as a result of the pandemic. And that obviously allowed them to continue their survey operations when they weren't doing face-to-face. But what was interesting is that we asked them how much of an impact did they think that had on the quality of their data. And we found that a relatively small minority of countries actually felt that it had had a substantial impact on data quality. And this seems to be consistent with what you're saying, is that in the end, when you compare the distribution of populations by these various methods, you didn't see as great a difference as you might have thought. Now, so I might come to, I was going to come to James on this, but I know, Gerald, you did have your hand up. I wondered, did you want to come in on this point of inclusivity?
No, actually, if you allow me, I just wanted to raise a point and make a comment on the previous point on timeliness. So if you allow me very briefly, so I think this issue of timeliness, it's not new, obviously. I mean, this has been one of the main criticism raised towards household surveys, that it takes a long time. And now we feel like with often in the conversation I'm part of, we tend to see whether it's a phone survey or it's a web survey as the solution to all evil. I think we need to be careful about that, because first of all, timeliness is more important for certain indicators, for certain type of information, and less for others. So let's not put everything in one bunch. So even at this balance, timeliness, quality, obviously we want to be on time and we want to have the highest quality. I mean, but this is not, it doesn't apply to every variable in the same way, every indicator in the same way. And we need to make this different. But also, so what we have seen already, and I think there is also a need to further accelerate this process. Surveys have been a lot more timely now than they were 10 years ago. We have moved a lot. If we think about it, the time of release of data, of household survey data, it's a lot faster now than say 10 years ago. So we're able to produce but also a third point, it's like the speed at which, for instance, phone surveys were able to go to the field also depended on the availability of a proper frame, of a proper pre-pandemic survey. So by having the survey allows not only greater speed, but also better quality, because you were able to be in the field, at least in the case of the LSMS, we were able to be in the field within 30 days in countries where we had a pre-pandemic survey. So for example, in Uganda, in Tanzania, and Nigeria. So we had a baseline on which to build. So this is to make the point that the timeliness of one instrument also depends on the availability of another instrument, like a survey. And that allowed, again, speed. So we were able to be in the field with a phone survey within, weeks. But also the availability of the pre-pandemic, and this kind of links to the point of quality. We were able to adjust for coverage issues and bias issues upon survey. So there is an issue of ex ante, the provision and the availability of the frame that improved on the coverage, improved on the minimization of the bias, but also exposed because that information allowed for further improving the quality of the phone survey. So these are kind of, I just want to make this point because I kind of get worried when we start to dichotomize this thing. One is fast, one is slow, and so I think there is a lot that can be achieved by thinking about data systems that will allow to respond in fast enough and with the quality that we all need.
Yeah, thanks, Gero. No, I think it's an excellent point. I mean, it is an overall connected system of data that does the best job. And I think following up on that, so if you invest at some point in time, for example, in having a good frame, it reaps benefits for quite a long time afterwards. Maybe James, I'll come to you on this point in Uganda, because I think you mentioned in your first intervention these concerns about representativity if you just switch to telephone interviewing, because there's this lack of coverage among certain groups in the population, for example. I mean, how do you see the future there? Because there has been a lot of talk about, oh, now the future is telephone surveys. And I think ideally there could be a large element of that, but we can't forget about face-to-face surveys either, for various benefits that they bring. But I mean, how do you move forward in your situation where you do have these concerns about, are you going to cover the full population if you migrate? And where do you see this connected path of different surveys in Uganda in the future? Is it going to revert to being mostly face-to-face? Do you see yourself being able to move more towards remote data collection, or how do you see it going?
Thank you. I think from the point of view of course, what I mentioned earlier, I think the two have to continue. But one of the lessons on how to deal with that in Uganda that we felt that we need to prepare for is that, because we never know, there might be another COVID-19, another pandemic. And so we are planning for the census, but for the first time, there are certain variables we are adding so that, going forward in future, we have certain information across the entire population, which information we used not to pick before. And the idea is, because the challenge came that during the lockdown, we were asked specifically to provide the number of vulnerable populations in the country, and we didn't have an answer. And so we are trying to see in the future how can we position ourselves to respond to such kind of situations. And so we are trying to collect some information as part of the mapping activity in preparation for the census, so that we test it out. We have time to cross-check this information and generate different frames, a telephone frame and other frames, so that we can be able to use the different approaches. Because as you have rightly put it, I think we are not going to stop telephone interviews now. These are approaches that will continue. The traditional face-to-face will continue, because as Jera has indicated and as I mentioned, we need to be mindful of the kind of indicators we are targeting, because that should inform the best method to use. But also in our situation, I think what this environment brings to the fore is that we need to engage with us, cultivating a relationship where we'll be able to get some of this, to see how we can access some of the information, say telephone contact, especially in areas that are not well served. And so that we continuously improve, say, the telephone approaches. And so, the relationship between NSO, at least the Bureau of Statistics, and the telecom companies has not been that close. And so we need to take it to another level to see how we can benefit, but also provide them with the information and show them that, well, when we work as partners, we can serve the greater audience better. So I think, looking at, the kind of information from both, because maybe if I give an example, we are conducting a household survey when the lockdown was imposed. And then when it was lifted, we again continued. So now when you compare some of that information, and they also look at the interview through telephone, I think that there is a very close association. We are actually now going to follow up on some of those very households and see, using telephone, and then try to compare. Then we shall probably also sample to actually do physical interviews. So in short, I think, to me, going forward, the two approaches are going to continue, because we simply can't go back to where we are, but also the face-to-face will continue. And so I think the challenge here has to be, or the decision is, to engage with the stakeholders and identify the kind of information that we should be able to provide routinely and quickly using the telephone interview, but also based on the development framework, the kind of information that we have to continue to provide through the face-to-face interviews. Thank you.
Thank you, James. I think you actually have brought us nicely also to perhaps the last topic we'll touch on in a bit of detail, which is ethics. So as you say, there's this potential push to use data from providers, for example, phone providers, phone networks that might have contact details already available. But this actually does bring up data confidentiality concerns, which aren't always necessarily going to be possible to get around, depending on your legal situation. So, I mean, Ali, I do wonder about this. Is this a challenge that you faced in Indonesia? Are these confidentiality concerns because you've been forced to react in new ways? And it mightn't always be the easiest thing to keep sight of confidentiality at the same time as trying to manage all these demands. So has this come up in Indonesia?
Yeah, in the case of Indonesia, maybe not quite significant issue because when we conducting online survey, for example, we always put a declaration that completing this survey is fully voluntary, especially in the online survey, and the information provided will be kept confidential. In our online survey, we also try to collect information about the phone number that I said, what their numbers, respondents' numbers to be used for the next survey. And we ask respondent to fill the question about their phone number, for not compulsory, but around maybe 80% of the sample which I got from around 212,000 respondents in the last online survey, they provided their phone numbers. Then they want and they are ready to be contacted again for the next survey. Thank you.
Okay, so I mean, basically, you're dealing with any ethical considerations by making it transparent why you're capturing information like contact details at the time. And I think it's in some countries it's been tricky in a different way, that maybe thing is they have contact details, they weren't originally collected for that purpose, but now there's obviously a great temptation to do a survey using those details because you don't have an option. But obviously that wasn't quite the situation you had there. I wonder, Sophia, in Palestine, has this been something that has come up as any kind of concern, any ethics or ethical or confidentiality considerations, or not yet?
Yeah, okay. As we know, for acting on our data collection, we will most likely have to engage with population and other stakeholders. So when approaching responders with data collection requests, it is important to be aware of certain ethical issues. And here, when I'm talking about ethical consideration, I refer to the ethical practices of how data is collected, stored, or shared. So detailed data or information for affected person with coronavirus is a critical issue to analyze the background characteristics, which is a problem to be shared with others, such as researchers, partners, etc., while it's strictly confidential. Thanks.
Okay, thank you. So, I mean, we are getting close to the point where we'll run out of time. So I want to anticipate that a bit. Firstly, I'll come to a question that came up on the chat, and this is about the idea of quality assessment. So what approaches have people used to address data quality? How are variances with historical data addressed? And did you realize shifts in trends, and how did you address them? So I mean, I guess any of the panelists could potentially deal with this. Larry, I guess you have very high frequency indicators in Canada. Did you catch shifts in your series, or through your quality? What did you take any new approaches to quality assessment, or were you satisfied with the approaches you were already using?
It's a good question, and I think this is something we've been struggling with well before COVID, and we will struggle with well after COVID. You know, I think the variance is one part, but where we're really starting to hone in on how do we start trying to figure out how to deal with bias in our surveys, as you know, even the best, some of our best response rates are becoming a real challenge to maintain for a lot of the surveys, even a lot of the COVID surveys we did do specifically. We're able to get about a 50% response rate without too much effort. But depending on the topic, that could drop down to 25, 20% fairly quickly, and or based on length or whatever. So we're even exploring, you know, what's better. Now it's very early days, so I don't have anything really to add in terms of specifics, but you know, how do we maybe put some funding aside for a survey to really do a good job at that non-response follow-up to find out who is not responding really well to our surveys and why. One of the things we noticed when we did the crowdsource, you know, women, highly educated individuals, older individuals were far more likely to respond, which is not a surprise. That's a similar trend to a lot of our regular surveys. That's where a lot of the effort goes. But you know, the concern is, and this was even, I think, amplified through COVID. Everyone has been impacted differently, depending on your background and your educational status, and even the type of job. You know, if you're a manual labor in the restaurant business, COVID had a horrendous impact on that group. If you're, you know, well-educated white collar office worker, you know, working from home, outside of some of the isolation, which I could speak to, it didn't really have that big an impact from a financial perspective. But it's, and the part that I think is starting to concern us is what we don't know about who didn't respond. And so we're really starting to think about how to go about doing that and working that in as part of some of our regular survey work. And now that we've got these new tools, we have much more frequency and opportunities to experiment with some of this as well, which I think is another important thing, which you know, it's putting that effort aside to do those experiments and continually evolve with what you're doing, which was something that we didn't necessarily have to do easily before the pandemic, but now we're kind of we're working it in with just our regular work. What are the experiments we want to do during the day, and how do we just work it in with the tools we have in place?
Well, thank you, Larry. Yeah, I think perhaps the profile of the need to assess quality very well and identify biases has grown. It's always been there. I mean, there's been plenty of documentation in the past on quality assessment and assurance in statistics, but I think it's probably an area that a lot haven't invested enough in practice, and particularly a change like what's happened in COVID, which should undoubtedly have led to increase in bias, but it's difficult to assess in what way. Has really, I think, opened our minds to the need for more work here. Ali, I noticed you had your hand raised on this point. Please come in.
Yeah, I just want to share that in 2 household surveys, and the National Statistical Survey and also Labor Force Survey in Indonesia, the chief statistician in BPS decided not to sacrifice the accuracy of this survey, because these 2 main survey are producing many indicators for many purposes. And in this regard, we try to manage to cover the population as normal and manage to keep surveys going. But of course, by implementing some strategies like dropping an important question in the questionnaire, applying very tight health protocol in the field enumeration, also implementing mitigation scheme where the case household will fail to be interviewed due to their reluctance or rejection to conduct face-to-face survey. The field worker would ask their phone number to, and later they would be interviewed by phone. And other strategy is like making adjustment in questionnaire. For example, in the labor force survey, which is a panel survey between February and August, we created pre-printed field questionnaire for a number of questions that are assumed to be almost likely unchanged using information provided by the survey in the previous period, but such questions were to be confirmed in the field, and this conducted in the last survey. But today I just had conversation with my colleagues in the several regions with regard to the current implementation of labor force survey in this February. That many of them reported that many field workers, both supervisors and interviewers, and also respondents were affected or exposed by COVID-19, and what they do to guarantee like inclusiveness. They try to interview respondents using mobile phone, especially when those who cannot be met, and also wait for the end of the isolation period, because many of them are in the conducted self-isolation, and also like postpone data collection for those affected. And if this surpass the time limit, the period, maybe it's likely to the respondent will not give the response. But until now, we have experience of during the COVID that they still got a high response in this household surveys, about 97% of the total sample that allocated in the probabilistic sampling. That's what we did. And trust, I think, is important, because community trust to BPS actually that we can conduct this in timely manner. Thank you.
Thanks, Ali. I mean, I think that's probably a very good point to come to our closing here, subject to any Q&A. And it is a reflection we've had from our connection with countries. Countries' NSOs, statistical compilers, have in fact done, in my opinion, an incredible job of maintaining statistical data collections and maintaining the flow of data in very, very challenging circumstances. There were so many ways in which data collection could have been derailed, so many potential areas of data quality impact. That is incredible, such as the staff themselves becoming ill. All right. I mean, you know, this the need to work remotely instead of in the office, and all of the practical implications of that. The fact that changing mode requires you to review your questionnaire and look at the priorities. The fact that there were new demands even for existing surveys. So many LFSs had to add questions to meet user demands and so on. And that's just speaking from the LFS area. So everyone was impacted in so many ways. So the fact of the matter is, countries have done very well to face those challenges. Even though I do think we can do more on assessing biases. Sophia, I'll come to you in a moment, but I do want to mention one very quick thing, which is that the Inter-Secretariat Working Group on Household Surveys is currently working on finalising a note about quality assessment. In fact, I think I have the name of it. Guidance note on assessing and minimizing the COVID impact on survey quality, which sounds like it should be highly relevant to a lot of the things we've just been talking about. So before turning to Papa for the closing, I'd like to go back to Sophia. You have your hand up. You're very welcome to take the virtual floor.
Yeah, thanks. Just to say here that all the national statistical systems and all partners have to work together to provide a quick response in times of uncertainty when timely data are needed the most. And national statistical system have to produce high quality, timely and disaggregated data by integrating innovative data sources, taking in our consideration the fundamental principle of official statistics. Thanks.
Thank you for Sophia. In fact, I think it underlines perhaps a message that comes out consistently, that we need to view this as a connected system of different sources, of different surveys, where we're meeting user demands over time, not just at a point in time. We shouldn't see different sources as necessarily competing with each other. They complement each other. And that can be, as Jero said, not just that they complement each other in their outputs, but they actually complement each other in their operation, because one survey provides a reference frame for another survey, and so on and so forth. So it promotes the idea of joined up planning. So I think this has been an excellent panel. I think we could spend 10 times as much time talking about these issues, and we still wouldn't get through it, to be honest, everything that's happened. But for my part, I really want to thank our panelists for your generous time and sharing of experience. I think everyone who's been listening will have learned a lot, but it's not over, because I do have to pass to Papa Sec for the closing. So again, thank you to everyone, and thank you to everyone who's participated in the call. Papa, over to you.
Thanks very much, Kieran, and really thanks to everyone for participating in this event. It was indeed a great opportunity for me to hear distinct but converging insights on the challenges brought about by COVID-19 in producing timely and high-quality data towards evidence-based recovery. These challenges have really demonstrated the resilience and responsiveness of the statistical community at national and international levels, but also the innovative actions that were taken to meet the increasing data demands. We've heard from 4 excellent panelists and on what they have done to overcome the challenges. For example, Larry spoke about the expanded toolbox and the permanent shift really, I think, currently underway, and critically on the importance of talking to users. Sophia and James spoke about the cost of producing data that is untimely and comparability issues as well. And the fact that there is really, I think, a balance that is needed between these considerations. And it is not one versus the other, but how do we achieve that balance? Ali also shared with us the experiences of using non-probability sampling and the extent to which they actually mirrored the patterns they see from quality survey data. Again, for me, I think this goes back to the point about what is good enough data and for what purpose, right? So, and another point that it suggests is really, I think, the need for effective communication strategies and critically engaging users that can allow them to understand what data they are looking at, right? And I think this can be communicated. It's just really that how do we communicate that, I think, needs to be thought through and strategies developed in that regard. And just some other reflections from our conversations today. And these are, three things that I'm really getting from this conversation. First, in times of crisis, our actions to produce quick but quality data is really important. But it's also important to emphasize that new data does not necessarily mean data that comes from new surveys. New data can also come from reprocessing existing survey data or integration with other data sources. And we've heard that today. And tapping into the strengths that other data sources have to offer. And, household surveys really, I think, are a central element in that regard that I think Jero spoke about. Our timely data response then becomes valuable if these are intentionally used to address policy and programmatic gaps. Second, we need to reevaluate the effects of these emerging approaches in reaching hard-to-reach and vulnerable populations. We need to design surveys that recognize different situations of individuals and even within households or establishments and other units. Unfortunately, we all know that by using telephone and web surveys during the crisis, we might have missed vulnerable population groups. When we talk about not going back, this is absolutely true. We cannot let that happen again. We need to have tools to ensure that data and mechanisms for reaching the furthest behind are consistently in place and to build on in case of shock, crisis, and emergencies. COVID-19 is definitely not the last crisis or emergency that we will face, and we need to be ready for the next one. And we are still well behind the curve in this regard. Third and finally, we need to promote data use. I cannot emphasize this enough. Data that are not used are not useful, period. Good enough but timely data, again, stressing the good enough element that is used is worth, at least to me, more than perfect data that is useless, maybe because it is dated. Because let's face it, dated data can also be dangerous, no matter how good it is, because it may actually be referring to a past problem. If you think about inflation data, for instance, timeliness is key. Here, an important point is that we need to do a better job engaging with users, and that would make household surveys and other data that we produce more likely to be used. And hopefully these are all lessons that we have learned from the pandemic. To close, let me just connect this discussion with what we've been doing here, the work that we've been doing at the Inter-Secretariat Working Group on household surveys. What we heard today, for instance, reconfirms some of the priority areas that we have highlighted in the position paper that is being prepared, that we've prepared as a background to the Statistical Commission under item 3A. The paper highlighted 8 technical priority areas for household surveys to overcome existing challenges, adapt to the changing data ecosystem, meet the ever-increasing demand for data, and increase development policy and research impact in the remaining years under the 2030 Agenda for Sustainable Development. Moving forward, we look forward to continuing to communicate and learn with you while fulfilling our common goal of developing and supporting the adoption of innovative survey methodologies and advocating for the importance of household surveys. Again, I would like to really thank all of the speakers and participants for joining us today. But I also particularly want to acknowledge and thank Kieran for the excellent moderation, and Harry, who's the Inter-Secretariat Working Group Coordinator, who did a great job of organizing this event. Wishing you all a lovely day and evening. Thank you very much.
Thank you.
Thank you,
Thanks all.
everyone.
Thank you.
Thanks,
Bye-bye.
everyone.
Thank you.
Bye.
So, bye-bye.
Bye.